I'm now going to demonstrate providing trach care. I have some peroxide, some normal saline, and I'm loosening the caps on those. I also have a pair of clean gloves, a trach care kit, which I'm going to be using, and a red trash bag. I'm going to wash my hands. I come in the room, explain the procedure to the patient, put the bed up a little bit. And I'm going to apply my clean gloves to take the trach mask off. And I'm going to place that on the patient's chest. I'm going to remove the old dressing, wrap that up in my clean gloves, and dispose of in the red bag. Now I'm going to open up my kit, and on the top of my kit, the first thing I see is a pair of sterile gloves. I'm going to take those out, put those on. When we give trach care, we clean with peroxide, and then we use the saline to rinse. So I've got my sterile gloves on. Now the sterile glove package I don't need, so I'm just going to get rid of that. And then in the kit you'll find a sterile drape, and I'm going to place that out for the sterile field area. Shiny side down, and that's going to be my sterile field. And I'm going to take all my supplies and put them on the sterile field, and then pour my liquids into the kit. I have a trach cleaning brush to clean the inside of the trach, Q-tips to clean the outside of the trach. We have trach ties, but I don't really need trach ties. This trach has a Velcro trach strap on the patient, so unless it's soiled, you wouldn't need to change that. I've got some cleaning 4x4s, so I'm just going to put a couple of those over here. There's actually 4 of them. I'm not going to use all of them, but you can if you needed to. And then I also have a new sterile trach dressing to place on after I clean the area. So now I'm going to contaminate a hand. I prefer to contaminate my non-dominant hand. First I'm going to take the peroxide. I'm going to lip the edge of that into the red bag, and then I'm going to pour that into the large container. There's 3 containers in your kit. I'm going to use the largest one for that, and I'm just going to set it over here. Careful not to go over my sterile field. And then I'm going to take the saline, lip that, and then I'm going to pour that in the medium-sized container. And I'll put this over here just so you can see what I'm doing. So now I have peroxide in here, saline in here. I'm going to get my supplies ready and put them in the 3rd container, which is empty. So first I want to take one of my cleaning pads, a 4x4, soak it in peroxide, rinse that out really good. I'm going to place this in the container without fluid. And I'm also going to take a Q-tip with peroxide and stick that in there too. Then I'm going to take some another 4x4 and rinse it with saline, squeeze that out, put that right next to the peroxide one. Saline, put that in here. So I have peroxide first and then saline after to rinse it off with. Okay, now I think I'm all set to take out the inner cannula. This has like a little lock to it, so you have to turn it to unlock it. I can touch the outside of the inner cannula with my clean hand. The inside is what needs to be kept sterile. So I'm going to take that out. Careful not to touch the inside, and I'm going to drop that right in my peroxide. And it's all bubbling and cleaning. And now what I'm going to do is pick up my brush with my sterile hand, the tip with my sterile hand, because that's the part we want to maintain sterility. And then I'm going to grab it with my clean hand at the top. Now I'm going to remove my inner cannula, sterile hand, inner part of the inner cannula, which is this part. And I'm going to clean that real well. Get rid of my brush, and then I'm just going to dip this in the saline and rinse it out, and then put it back into the patient. I can touch the outside again with my clean hand. It's easier sometimes to grab it that way. Lock it in place. And now I have pretty much the most sterile part over with, because you really want to keep that inner cannula sterile. Now I'm going to do the cleaning of the faceplate and underneath the faceplate. So first I'm going to take the peroxide, and you could use this on top or underneath. I like to go underneath with the Q-tips only because it's really hard to get underneath the faceplate. Usually sometimes it's sutured on each side and it's usually real tight. So clean that with peroxide, and then I'm going to take some saline and rinse it. Then I'm going to take my peroxide 4x4, clean the outside of the faceplate. And you make sure you clean really well underneath the faceplate, because you can get some damage there if you leave drainage. And then I'm going to rinse that with saline. Lastly, I'm going to take my new sterile dressing and replace that underneath the faceplate, which is not an easy task. But once you get that underneath, at this point it becomes clean. It's really tough to keep sterile at this point. And then I'm going to replace my trach mask. It snaps on the side. Okay, and remove my clean sterile gloves, they were initially, and then wash my hands after I raise the bed rail and put the bed down. And that's it for providing trach care for the patient.